I'm going to interrupt. I'm sorry. I came here for a reason. It wasn't eye candy. See this hair? MRV, MRA, imaging of the veins. I did that at Baylor a few months ago, and I had 100% blockage in my left jugular and almost all in my right. How many MS patients do you see that have that? How significant is it?
So to have one jugular to be a normal area.
If the MRV was done with me laying down the image, could the imaging itself be inadequate or not positive?
So the way blood flows through the veins is very dependent on the position that we're at. So if you're up 30 degrees, it will be very different than if we're down flat. And that's why studies that look at changes in veins have to be done under blind conditions so that people don't know whether somebody has MS or not.
Okay, is MRV a significant way of trying to find cure for it? Do you do that on your patients?
We do not.
Okay.
We do not. I might ask Adam, what about anabolic steroids for muscle atrophy?
I don't know of any data to support the use of anabolic steroids. It just speaks to the fact there are many, many studies out there that we'd like to do. I do want to comment on the fact that was raised about medical marijuana. There was a study that just came out that showed that medical marijuana has a pretty profound effect on people's concentration. So that although, as I mentioned, there were studies that were done, double-blind studies in England, looking at medical marijuana, and they showed that some patients had decreased spasticity. What I just like to remind people is those studies that were done, you weren't allowed to drive because you were stoned the whole time. So I just think it's important to recognize that these things all have side effects, and if you're, it's a risk-benefit analysis. So if you want to risk, there are a number of complications of anabolic steroids, cardiovascular and the like, and we don't have good evidence to support their use in MS. On the other hand, with medical marijuana, we do have some evidence that suggests it may be beneficial for some spasticity, but you pay a great price in terms of your concentration. So it's a matter of the risk of that.
Thank you. This is a complicated question that needs a simple answer. What are the treatments available for depression?
So I think the most important thing is to make sure you see somebody who has some familiarity in diagnosing depression. If it's something that you're not sure about, just that if it enters into your head, gee, could this be depression? You should go and get screened by someone who has expertise in it and can work with you. There's a number of treatments. We know that exercise, for instance, is very effective at stimulating growth factors in the brain. We know that medications have neuroprotective effects, as Emmanuel mentioned, lithium and the SSRIs. The good news is that depression is treatable. I expect everybody with depression to get 100% well from their depression with adequate and aggressive management.
Thank you. We've been doing this for a number of years, but without question, this audience has the best penmanship of any. I'll answer a few questions myself. Why isn't there a national database for people that are willing to participate in trials or research? There is. It's called clinicaltrials.gov. And those of you who ask questions about the pharmaceutical industry, we need to push the pharmaceutical industry to register all their trials on clinicaltrials.gov, including those trials which are not taking place in the United States. And an increasing number of trials are taking place in other parts of the world. So there is this registry that you can access through the internet. Next question, have there been further studies indicating a role of inheritance? Yes, there is a very exciting study that will be published and you'll hear about in the next 6 to 8 weeks. This is an international consortium studying the genetics of MS, and the Nancy Davis investigators are part of that international consortium. a study looking at the entire genetic background of 20,000 people with MS from all over the world, and about 100,000 people without MS from all over the world. 57 genes have now been found that influence MS. The genes work together, and they're going to tell us about why some of us are at higher risk. And also they're going to tell us about how to develop new drugs. 55 of these genes we think work on the immune system. It's interesting, there are no neurologic, neurodegenerative genes that are in this group that were discovered. So this says that perhaps if we can stop the abnormal immune reaction, there will not be a neurodegenerative or progressive phase. If we can stop MS at the beginning. 2 of the genes, though, are very interesting. They're the genes that control the synthesis and the degradation of vitamin D. Now, we get vitamin D mostly from the sun. Some of us get it from seafood. But because we live inside under fluorescent lights, we wear sunscreen when we're outside, more than 90% of the Western world is vitamin D deficient. We now know that this revs up the immune system and contributes to risk for MS. And Dr. Wobant and others are now looking to see if once MS begins, if vitamin D deficiency makes the MS more active. But the preliminary evidence suggests that it might. So we now believe that everybody with MS and probably everybody without MS should receive vitamin D supplementation, perhaps as much as 4,000 international units a day if your vitamin D levels are low. Probably 40% of MS worldwide would not happen if we could correct vitamin D deficiency.
What would a low level be?
I'd like people to be above 60. Yes.
What's too high?
We don't know what is too high. And there really is, we have worried that too much vitamin D would give high levels of calcium and could give stones in the renal stones and maybe calcium deposits elsewhere. But at 4,000 units, the Institute of Medicine, National Academy of Sciences, now have advised this for people. It's very good for osteoporosis, and it's probably very good for MS. And the genetic trail emphasizes the importance of vitamin D for MS.
Dr. Hauser on.
So they do, but the active form of vitamin D, 3-hydroxyvitamin D is fine, yes. It's also interesting that just 20 minutes of sunlight, maybe just to the arms, twice a week, may be the equivalent of 30,000 units of vitamin D every day. Yes, without sunscreen. So let me move for the moment to what Claudia called the lightning round. But I can only move there if Dr. Weiner is on his game. Are you ready, Howard?
I'm ready.
What do you think about the new oral MS drugs coming on the market?
The oral MS drugs are very exciting. There's fingolimod, there's cladribine, which may or may not be approved. There's BG12, there's teriflunomide, and there's laquinimod. So people who are doing well on their current therapies probably shouldn't switch. If you're just starting, you might start the medicine, but in the future, many people will move to oral therapies.